Welcome everybody to our coronavirus update in Colorado. We're at 4,678 new cases today. There's been a leveling out. It hasn't gotten worse but it hasn't gotten much better. So hopefully this is a place where things will start to turn. But that really is entirely depends on whether we're succeeding now and in the next few weeks on wearing our masks whenever we're around others, avoiding social interactions, keeping our distance. But before it's welcome news for things to stop getting worse. It'll be more welcome when they start materially improving. We have 1,559 currently hospitalized, also down a bit from the highs, which is good. But just to put things in perspective, it was only early October when we had 300 to 400 hospitalized, and now over 1,500. I would add that tragically the death rate, that's the last one to start coming down. It has not really started coming down yet because that is has a lag factor. So hopefully we're doing a little better, and at least things aren't getting worse. But we really want things to get better so we can go back to living our lives and normal and all of those wonderful things. And that is really a function of how well we do social distancing, how well we reduce our interactions with others, wear masks, 50 to 70% effective. We're going to talk a little bit about the vaccine, and we just in the last few days rolled out wonderful vaccine plans, 94%, 95% effective, very, very highly effective. But we have today a vaccine that's 50 to 75% effective. That's called a mask. So not, of course, as effective as the vaccine that goes in the arm, but can play a role in reducing your odds of getting it by 50%. But also, when everyone wears masks, it reduces the immunity transmission, reduces the spread, allows us to open more things to be open for us to enjoy them safely, etc. Earlier this week we walked through our plans on the vaccines. We also did a dry run of the vaccine delivery into Eagle County. Um, our top priority, of course, is saving the maximum number of lives, ending the public health crisis, getting back to normal. I think at this point, people know that doesn't instantaneously happen. In fact, what's important to know is when you are fortunate enough to be able to get the vaccine, you don't have immunity a day later, even a week later, right? You get the first dose of the vaccine, 20 to 25 days later, the second dose, and then within 2 weeks of that, 10 days of that is when you develop the immunity. So I want to make sure people are smart as we get vaccinated. We've talked about the marathon, right? I think when you get that vaccine, that means you're, you know, 50 yards from the end. You can see it, right? And then what we don't want to do is that's when you do a big dance and use all your energy and then collapse and don't make it to the finish line. You got that vaccine, finish out the 50 yards. We're just talking another, month and a half till that immunity builds. First dose, second dose, 20 to 25 days later, within 2 weeks, immunity. There is some evidence that there's some immunity from that first dose, not as significant, not as effective, but there might be some increased protection, but that's not something that we want to count on. We want that full 94, 95% immunity. And we're encouraged by initial data that also shows that even for those who contract it, in that, again, 94% is not 100%. So some people contract that it is more mild. That is preliminary data, but that is similar to what we see with the flu vaccine, right? You get the flu vaccine, you hope it prevents the flu, but then if you get the flu, it is a more minor version of the flu. There's initial evidence that would indicate that that is the case with the COVID vaccine as well. Needs to be demonstrated. We know it prevents 94, 95%. That's demonstrated. The reduction in severity, encouraging data. Just yesterday, an FDA panel formally recommended the FDA approve the Pfizer vaccine. That'll be the first one. Then the Moderna vaccine. We, of course, want doses for everybody in Colorado. Expect that. But the first batch that we are getting will have 46,800 of the Pfizer doses. And then we believe the first Moderna shipment, hopefully within a week or two after that, will have 95,600 doses. So one of our priorities in this is to ensure that not a single dose goes to waste. So we are making sure that all of the entities receiving the vaccine, and this is we walk through the whole logistical endeavor. It's the nursing homes, it's the hospitals, all the entities who are receiving it have to administer it within 72 hours, or we'll take it back and use it for someone else. I mean, it should never go to anybody to sit there. And it also, of course, expires. So we want to give them, 72 hours. When they get it, they can deliver it. And if they don't, we have many others who would love to receive that vaccine. It's also, these vaccines come in batches, and we want to make sure that when one is deployed, opened, removed from freezing, that every single one of them is then administered in someone's arm while the vaccine is good. So that's our goal with this. Our ability to quickly vaccinize folks and report those doses administered is going to be very important in reaching more immunity levels, saving lives, returning to normal, ending the crisis. We're hopeful that we can get through the phase one that we laid out of vaccinations this winter. Obviously, all of this depends on the amount received. Every single dose has been ordered by the federal government, right? So everything being produced then gets distributed based on pro rata population, our percentage of the national population. Boom, it's fair. We don't know the exact numbers till we get them. The feds don't either, but at least we know that first week number that we'll be getting of the Pfizer vaccine, 46,800. And then we believe, well, again, trust but verify, but we believe the first Moderna vaccine, hopefully a week or two later, needs to be approved, obviously, before 95,600. We do not yet have visibility into week 3 or week 4, week 5. We would love to see those numbers go up to fulfill our orders for every man and woman in Colorado and child. Eventually, they're not yet approved for under 18. There are groups out there 12 and up being tested. Right now, it is this preliminary approval on the Pfizer 18 and up. So we're getting there, right? We're getting there. The triumph of modern science, not just a vaccine, but a highly effective vaccine. I mean, this is gold standard, 95%, end the pandemic. It won't make coronavirus extinct necessarily, just like measles and mumps, they're not extinct, but it'll relegate it to a rare event, which is wonderful. Now, while it's exciting, again, we have to really double down on getting these numbers down so we can return to more meaningful life and socializing. But we have to show progress on the numbers so it's reasonably safe. And as we get closer to the winter holiday season, and happy Hanukkah, we had first night last night, Merry Christmas coming up, Kwanzaa, winter solstice, those who just like having trees, whatever your religious tradition or faith is, or however you like to observe December and Christmas, we know that this one will be a little bit different. And when Dr. Fauci joined us a week and a half, 2 weeks ago or so, he highlighted some of the risks around travel and holiday season and crowded shopping areas, Black Friday, all of those things. And that's really the same for Christmas. People just need to be very, very careful this Christmas. It's possible some of your elderly relatives in nursing homes might be getting the vaccine around Christmas. But here's the important thing to remember. They are not immune right when they get that first dose. So they get that dose. It doesn't mean that they can be safely visited the next day, right? They might have some resistance within a couple weeks, but the second dose is 20 to 25 days later. And then 10 days after that, 95, 96%. That means grandma, grandpa, safe, visit, have fun. But not they got the vaccine. Now 2 days later, it's Christmas. I'm going to go see them. They have there's no evidence they have any additional protection. 2 days after they get a vaccine, your body is just starting to create antibodies from that first dose. So that's very important. That as we plan our holiday season, visit with people virtually, outdoors with masks. Have your plans later. Obviously, many people have the religious plans this time of year, Christmas, Mass, and so forth, the social distancing, the mask wearing, all of those things. Hanukkah is generally celebrated in people's homes, so it's not usually a need to go to a synagogue for that. But if you are engaging in the religious aspects, be safe, be smart. And particularly with the prevalence we have here, the 1 in 40 to 1 in 45 Coloradans contagious, I would very strongly advise people, that are vulnerable to find alternative ways to honor your faith traditions. If you're in your 70s or 80s, even with the precautions, mass reducing to 50% social distancing, it really you're almost there, and just sort of find that inner reservoir of strength to find a way to get through this holiday season so that you can enjoy many more holiday seasons. Right? We don't want to take that victory dance 50 yards from the marathon finish line and expend all of our energy and then collapse. We want to finish strong. We'll be celebrating with my family virtually, of course. Some ideas, you can watch the same movie, Christmas movie, and then discuss it with your family. You can, eat dinner together virtually. Obviously, some people are traveling, and if you are, just like for Thanksgiving, please take every precaution. But we all know the additional risks of traveling. If you do plan to see loved ones over Christmas, you can self quarantine for 10 days before, 2 weeks, 10 days before, where you're staying at home, not taking any risks, not going out. If you're able to do that, that obviously can reduce the risk as well. And we want to encourage people to shop locally for their loved ones. You can avoid crowds, and many stores have online centers, but also curbside pickup. Colorado's full of all sorts of creative small businesses that carry vastly superior made in Colorado products that are perfect for letting your friends and family, wherever they live, know that you care, that you're thinking about them. Maybe it's somebody who couldn't visit Colorado this year from Florida or New York or Colorado or California because of the risk. So send them a little piece of Colorado, right? Send them something made in Colorado, and of course a rain check on when they can safely visit. You can visit Colorado SBDC/shop-local to find local business supports near you. I know this is not an easy thing to get through these final days, especially in this wonderful Christmas season and holiday season. But Christmas and the season is really about love. And the best way that we show love for one another is to protect one another, especially our aunts and uncles and mothers and fathers and grandparents. So we don't want to put the people that we love in jeopardy. We want to make sure that everybody's around for a big old Christmas celebration next year. So wear a mask around others, stay 6 feet apart, avoid social gatherings with people who aren't in your immediate household. We want to minimize the spread of the disease. Hopefully, the leveling out will change to a significant reduction, but that's all in our hands, in your hands. And together, we can have a meaningful holiday season, save lives, and hasten the return to normalcy and the end of the pandemic. Thank you, and we'll take some questions.
Hi, Governor. It's Jessica Seaman with the Denver Post. This wave of the pandemic has become more deadly than what we saw in the spring. Is there more that the state could be doing to try to limit transmission and ultimately these deaths?
Yeah, so nationally, tragically, the daily record has been broken. There's been over 3,000 people 2 days ago. 2,600 people paid the ultimate price nationally yesterday. Here in Colorado, we are now at 3,005 people throughout the entire crisis who have died from COVID. About a third of those have been in the last month or two. The 2/3 were earlier. I think we've really wanted to elevate with people that now is the moment of greatest risk of contracting the virus. It's greater than it was in March. It's greater than it was in July. The most Coloradans have it that are now contagious. Now, that's why, and people always ask, well, why, can't we hang out and go to bars and all that? The normal way we socialize would lead to tragic levels of loss of life, double, triple, quadruple this number that is enough to mourn. So many Coloradans, just over 3,000, that have paid the ultimate price, others that struggle daily in the hospital with their lives. Um, well, the best thing that we can do to save additional lives is to avoid socializing with people outside of our homes, keep a distance from others, and wear our masks whenever we're around others, at work, at the store. If we can do those things well, we can make sure that we can honor the memory of those who've lost by preventing additional unnecessary loss from this pandemic here in Colorado.
Hello, Governor. This is Vinny Del Giudice of Bloomberg News in Denver. New Mexico is banning non-elective surgery in acute care hospitals until early January and moving closer to crisis care rationing. They've been low on ventilators, etc. Is Colorado close to emergency orders such as Mexico's? New Mexico. Thank you
We
very much.
monitor the information daily. New Mexico has had a higher infection rate over the last few weeks. I don't know their equipment situation. If they do need equipment, hopefully there's sufficient national pool to provide that. We do not have a shortage today of ventilators or of hospital beds. We have ready to go our alternative care sites. So if we are near that capacity within a week or two of breaching our hospital capacity, we will activate first the two smaller sites that we have, and if necessary, the convention center. So yes, we are closer to that than we were 2 months ago or 3 months ago. We stand ready, but we will make that decision based on the actual data that we have on the hospital capacity. I'm hopeful that the thoughtful efforts around mask wearing and social distancing will prevent our hospitals from being overrun. But yes, we have seen in other states, including neighboring states, having to go to some of those crisis standards of care.
Hello, Governor. Jesús Carrasquel from Noticias Univisión Colorado. Gobernador, ya tiene el plan de distribución de la vacuna, pero ¿cómo garantiza que la vacuna llegue a las minorías, incluyendo nuestra comunidad hispana e incluso los indocumentados?
Se trata de salvar la mayor cantidad de vidas de personas y poner fin a esta crisis con el vacuno. No le vamos a pedir su documentación. Hemos iniciado un grupo llamando Campeones por la Equidad de las Vacunas, que ayudará a facilitar el alcance comunitario y la participación de las partes interesadas, específicamente con las comunidades latinos en Colorado, incluido el español y inglés. También estamos en el proceso de ejecutar un contrato de marketing que implementará una campaña de información sólida, receptiva y dará a las jurisdicciones locales acceso al contenido correcto. La campaña de marketing está prevista para este año y el próximo año. Es muy importante que todas las vidas son una parte importante de nuestro estado y todos son una parte de nuestro plan de distribución de la vacuna.
Hi, Governor. It's Rick Salinger from Channel 4. Today, we received a list of all the hospitals and health departments that are going to be receiving the doses, hopefully, in the coming days, and the breakdown of how many to each. How did you go about breaking it down this way? Was this also based on population, or were there other factors as well?
So we in our vaccine presentation from earlier this week, we talked about the distribution centers and managing the cold supply chain, specifically challenging around the Pfizer vaccine. The Moderna vaccine is easier to move, requires traditional freezing versus the very cold freezing levels. So we have distribution centers across the state, and we can show you that map that shows the way that it gets to different areas, both for the hospitals who will be administering it to people who work in the COVID ward and around COVID patients first, and then residential care nursing homes are going to be in that very first group as well, especially with that Moderna vaccine.
Good morning, Governor. This is Stephanie Rodriguez with Telemundo Denver. Mi pregunta para usted es, viendo días muy letales este mes y sabiendo que el público en general no va a recibir esta vacuna hasta el próximo verano, ¿cuál es su consejo o su recomendación mientras esperamos?
Es muy importante saber que el momento que recibieron el vacuno no tiene más resistencia contra COVID. Necesita algunas semanas. Necesitan el primer parte de la vacuna y entonces 25 días más tarde el segundo. Y entonces hasta 1 o 2 semanas más, entonces está seguro. Durante este tiempo y antes de recibir el vacuno y después en el tiempo inmediante, es más importante que siempre usar tapabocas, tener una distancia entre usted y otras personas y no asociar con personas que no viven en su propia casa. Este es el momento más peligroso en todo el país y en nuestro estado también.
Hey, Governor, Jesse at the Colorado Sun. Your administration has put a lot of protections in place for nursing homes and prisons, but in this latest outbreak, we've seen a lot of new cases and a lot of new deaths in both places. I'm wondering if you're looking at additional steps to protect those two spots, particularly if you're going to reinstate the prison population reduction orders that you had in the spring, and whether you might send the National Guard in to help with testing at nursing homes.
Yeah, we as you know, have taken extraordinary steps because of the national data, which is no exception in Colorado, that particularly nursing homes are very hard hit. For a couple reasons. One is the nature of congregate living, but we also have congregate living at our colleges and universities and other places. The reason the death rate has been so high is because of the age, right? So it's very different. It spreads at a college, 1,000 people get it. We want to contain it, but there's really no death, and thankfully, I mean, there could be, but in the case of CU, no deaths in that outbreak, and only 1 or 2 even needed medical care, versus a death rate of 10-12% when you're talking about folks in their 80s and 90s. So I mean, if 10 people get it, 1 can die. Obviously, in prisons, we have people of all ages, and the priority is protecting those who are vulnerable, over 65. Just as we would prioritize people over 65 who are in the general population. So the answer is yes, additional steps taken. We do have testing. We have the National Guard ready to go if we're in a much better testing spot than we were a number of months ago. So, but if there's assistance needed, we can do that. Supplies are better. The Binax tests are being used. Those are the instant tests that are not as accurate, but have a result in 15 minutes and still can help weed out some of those cases. So we have that from the supply side. I would also point out that with some of those testing, they no longer require the presence of trained medical personnel. They're easier to administer, in fact, even self-administered. So we have a lot more in our arsenal around protecting both nursing homes and prisons and any other forms of congregate living. That is tempered somewhat by the fact that the virus has a higher prevalence now than it ever had before. I'm just grateful that with the virus at this prevalence, we have the multi set of tools to protect our vulnerable populations that would have only been a pipe dream back in March or April.
Hi, Governor. This is Karina Julich from the Aurora Sentinel. You said earlier this week that you're hoping that schools will be able to reopen in January. Something that's also been echoed by President-elect Biden, who announced that reopening the majority of schools is one of his key COVID priorities. However, local school boards have seemed to be a lot more reluctant to open schools when there's a high prevalence of COVID-19 cases in the community. So I guess, do you think it's realistic that schools will be able to reopen in January so soon after the Christmas holidays?
I do, and I know districts are hard at work on their plans to serve families and keep educators safe. We have a Back to School Task Force, I'll be joining one of their meetings later today. They've really done yeoman's work. The folks who stepped up, and school board members, superintendents, teachers, public health officials, to really provide the very best guidance, which will be forthcoming soon, around safe ways districts can come back. I think many districts have been successful in engaging and talking to their teachers and listening to concerns and addressing them. Many districts, of course, have been back the entire fall semester. Others have only been back for part of it or with some grades. But the data increasingly shows that schools are a relatively safe place to be. They're a low-risk environment, in many cases, the safest place for both the especially at-risk students, as well as for teachers and faculty when it's done the right way.
Hi, good morning, Governor Polis. I have a two-part question regarding vaccines. First, what are some of the challenges of storing a vaccine that health officials across the state have to deal with? For example, shelf life and freezer temperatures. And secondly, for people concerned about taking a vaccine, what information would you like to convey to them?
Yeah, so there's two different vaccines. The Pfizer vaccine, the one that we expect in the next few days, is the one that requires extraordinarily cold temperatures, 80 degrees, not more than a normal freezer. The Moderna vaccine, shortly on the heels of that, is frozen the same way frozen food is frozen. There's a really scalable existing supply chain. This is just a drop in the bucket for that. So there are more logistical issues around the movement and storage of the Pfizer vaccine. We're going to get it done. We have a plan to do it, but it involves extraordinary effort. The Moderna vaccine, more conventional supply chain, is being used for that. But I have great confidence in both, that the spoilage will be minimized. They will reach the target people and be delivered on time. What was your second question?
For people concerned about taking a vaccine, what information would you like to tell them?
Well, look, the FDA and the nation's top scientists have reviewed data from of people who volunteered as a test to have these two vaccines. They found not only great efficacy, but also great safety, meaning what people can expect is an experience similar to the flu vaccine. Some people the next day have a sore arm or aches and pains. That means your body is successfully developing antibodies. It's a minor immune reaction that happens. Some people have nothing afterwards. Some years I've gotten the flu vaccine, even if it's the same person. Some years I have had a sore arm and a little bit achy the next day. Other days didn't even remember that I got it. So it depends on the person, but really the same type of reaction. Very safe, very effective, ending the pandemic, protecting yourself, saving lives. Really just wonderful triumph of modern science.
Hi, Governor Polis. This is Faith Miller with Colorado Newsline. Do you plan to extend the state eviction moratorium after the new year? Thanks.
So the state eviction moratorium is designed to mirror the federal eviction moratorium to provide greater certainty and prevent a discrepancy between state and federal actions. We do plan to track closely with what the federal government is doing to avoid any confusion for landlords and tenants.
This is Erin Prater with the Gazette in Colorado Springs and Denver. I have a similar question to another one that was asked, but what can you tell us about the progress of the education work group that you convened? I know you touched on that a bit, but around here in the Pikes Peak region, we're hearing some districts expressing that they want to keep their brick and mortar schools open, but unless the guidance for quarantining for schools issued by the state is relaxed, that's just not possible at this point. So what would be your response to that? Thanks so much.
So the quarantine guidance was amended, consistent with the CDC, a week or two ago. So I think that's what the districts were talking about. So that has been done. And they really now have the tools they need to be able to return safely to in-classroom instruction, protecting the cohorts and keeping folks safe based on science and based on the CDC, which shares our state's priority of returning to school. The CDC, many public health departments have also written extensively about the public health benefit of school. We often talk about the educational benefit that should be obvious to parents and families, but there's also the public health benefit for families of kids being able to be in that environment in a safe way. And the guidance has been updated to encourage that to be done in a safe way. The return to bricks and mortar schools in a safe way.
Hi, it's Andrea Dukakis from Colorado Public Radio. Critics have said you caved to political pressure from folks when you changed the vaccine order and moved people in congregate settings down the list. Specifically, why didn't you follow the advice of doctors who spent a lot of months coming up with recommendations? And might they be reluctant in the future to be in an advisory role?
Well, we track really very closely with the CDC guidelines for administering the vaccine. With the goal of saving lives, it's critical to prioritize those who are most likely to die from the pandemic. And that means people over 65, people with pre-existing conditions. There are some people that are on COVID wards that are, of course, at much higher risk and would be early on because they contract, they face people with COVID in their daily lives, and we need them there to treat the COVID. But in general, this virus has a very different risk profile for people of different ages and different pre-existing conditions. And when you get to people in their 70s and 80s, they have a fatality rate 50, 100 times greater than younger people. And we're not without any fatalities for people in their 20s or 30s, but it is a very low level and very rare. So with the goal of saving lives, we respect the dignity and the inherent worth of all human lives. It's important to prioritize those that are most vulnerable and are likely to face the most severe health impacts if they were to contract COVID-19.
Governor Polis, this is Brian Ulmer from the Barn in northeastern Colorado, and I wanted to ask you a couple of questions here. First, did you happen to see the Facebook post to you directly from Caden Peel, a 15-year-old student at Merino High School, asking about getting the schools reopened, reinstating activities at the schools because there's a mental health stress? It's a pretty long post, but very well written by Caden. Bottom line, would you, your administration, CDPHE, and CHASA please reconsider the mental health damage that all of this canceling and postponing of events has done? We've had 7 suicides in northeastern Colorado since March in high school students.
Yeah, I think I'd love to see Caden's post if you can somehow forward it to us, or I can call Caden. And what school district did you say Caden is in?
Merino High School up just south of Sterling.
Yeah, just right. So so yeah, that's the reason. We absolutely, we talked earlier in this call about the health benefit of schools being back, the importance that schools are back, not just for education, of course, but that schools should also be back for in-person because of mental health for students, for faculty, for others involved. We strongly encourage all districts to return to in-person education. If they're doing in-person education, we hope they're also doing all of those important other extracurriculars in a safe way. We, of course, just recently finished the football season and other winter sports. So I think it's wonderful that you have a young leader there in Merino that is helping to lead the way in talking about the mental health benefit of kids being in school. That's exactly what we talk about in our back to school committee, trying to convince more districts that you can go back safely, you can do it in a safe way. And I hope that the young man is successful in getting activities back in eastern Colorado and across our state. And I would encourage more students to join in really talking about what school and what those activities mean to them. And if you can show us that post, we can help share that as well, or I can look at it and respond to it. Thank you. I think that's all the questions, and I want to wish everybody a happy holiday season, a Merry Christmas. As you start making your plans, be thoughtful, be safe. Initial data is that Coloradans did fairly well, perhaps better than many other states over Thanksgiving, and that we're seeing some national records, but here it's been level. But we need to do better. I mean, with 1,500 people in our hospitals and over 3,000 Coloradans have paid the ultimate price. Let's make sure that we're all here for many holidays to come. Happy Hanukkah, Merry Christmas, Happy Holidays. See you all soon.